Okay, thank you very much. I'm just being the shorter presenter here. I'll just lower my microphone slightly. So yesterday we talked about Moldova, and I must admit I learned so much about what is going on, and I do want to say congratulations to where you are in the process of protecting children. I'm now going to take you to Brussels, not physically, but I'm going to basically present information on Brussels. And I'm here to present, if I can just go forward. Yep. Okay. So I'm here to present around the Child Guarantee and implementation of policies for accession into the EU. But I just want to say that I'm going to provide information that I think you might find interesting, and I also think you'll find it reassuring. Because from what I was hearing yesterday and this morning, I think you are well on your way to meeting the requirements, especially from a child protection perspective. Okay, so first of all, I'd like to start with a little bit about EuroChild. We are a civil society organisation. We are not part of the EU institutions. So here you can see our vision and our mission. We have around 200 members across 41 European countries, and we're the largest children's rights organisation in Europe. And many of our members are actually national organisations themselves. So that means that our network reaches over 4,000 organisations and individuals, all promoting the rights and well-being of children in policy and practice. Civil society organisations in the EU play multiple roles. We are a source of information for citizens, governments and institutions. We monitor EU institutions, national governments, policies and actions, and we hold governments accountable through our membership. We also support the challenges of the processes, we engage in advocacy, and we offer alternative policies to what the institutions may be presenting. So to talk about Accession-aligned EU instruments, I want to talk about the EU strategy on the rights of the child. The date of this strategy is 2021 to 2024, so we are already halfway through implementing this strategy. It's based on the EU Charter of Fundamental Rights and the UN Convention of Children's Rights. And it was developed after much consultation with a wide range of stakeholders, including children. There's a particular report that you might want to find on the internet called Our Europe, Our Rights, Our Future, where over 10,000 children across Europe were basically asked what they wanted in regards to their rights and what they wanted the EU institutions to embed. Sorry, and that was the slide you should have seen when I was presenting that latest information. Okay, so the EU strategy on the rights of the child is actually made up of 6 thematic areas. In each of these areas, you will actually find different components. There is what the Commission should be carrying out, what they plan to do. So the first one, children's participation in political and democratic life. The Commission is setting up a child participation platform. In number 2, socio-economic inclusion, health and inclusion. This is basically the Child Guarantee as a whole. And this is where the Commission were to write and get agreement from the Council of the European Union to get all member states to agree to set up a national action plan for the Child Guarantee. The third one, combating violence and ensuring child protection, is another area that I'm not covering today, but you may want to go in and check out what is exactly in the child protection element. 4, child-friendly justice. 5, digital information society. This is not only platforms, but also children's rights in the digital environment. And 6 is the global dimension. And this is the external focus. So this is countries outside the EU that the Commission want to support from an EU, from a children's rights perspective. Just to give you some other information, the number 2, the thematic area 2, the socio-economic inclusion, health and education, linked to the Child Guarantee, part of the Commission's role was to review the Barcelona targets, which is how many children in each country should be accessing quality early childhood education and care. The new target that the Commission came up with and the Member States agreed was at least 45% of all children below the age of 3 should have the opportunity to participate in early childhood education and care. And at least 96% of children between the age of 3 and 6, or 3 and the starting age of compulsory education, should participate in early childhood education and care. Within these 6 thematic areas, you will also find in number 1 to 5 that there are member state recommendations. And the example I'm going to give you today is number 2, which is the National Action Plans for the Child Guarantee. But also in number 5, you will find recommendations for tech companies. And this is to support the rights of the child in the digital environment. So, focusing on the European Child Guarantee, here you can see a brief outline of what is included in the Child Guarantee, focusing on what member states should be doing. To give you a little history of the development of the Child Guarantee, on the 24th of March 2021, the European Commission adopted a proposal for Council recommendations to establish a European Child Guarantee, along with a supporting staff working document. The Council, this is the Council of the European Union, then adopted the proposed recommendation on the 14th of June that year. So 3 months they took to have a recommendation, and then it was adopted by all member states. So the Commission just actually celebrated the 2-year anniversary. The children listed on the slide are to be the priority of all member states, and these are the children that should be targeted within the Child Guarantee National Action Plans. There is also a set of key services that are aimed to prevent and combat social exclusion. And all these children are to be prioritised. And as you can see, children in alternative care, especially in institutional care, are one of the priorities. So the Child Guarantee is one of the priorities for EuroChild and our members across the EU. So the key services. So as we heard yesterday, one of the main deterrents of social exclusion of children is the unequal access to key services, the very services that children need for their well-being and their development. Children living in poverty or children from a disadvantaged background are more likely to face barriers in accessing early childhood education and care, inclusive education, healthcare, healthy nutrition, and adequate housing. They start their lives at a disadvantage, and this can have a long-term impact for their development and future prospects. But please just take note of the key words that I've highlighted on the slide. Thank you. The key words are, under the top 3, early childhood education and care, free education, and free healthcare. These are to be guaranteed. These are to be guaranteed to be free. Healthy nutrition and adequate housing, they are guaranteed effective access, so not free. So member states should, in accordance with national circumstances and approaches, so always considering what the national situation is, organise and provide these services, or to provide adequate benefits so that parents or guardians of children in need can actually cover these costs or access them in an appropriate way. All member states are expected to develop a national action plan that includes the targeted children specifically in their country, data, the key services needed, including whatever the gaps are, what funding is being used to support this, and how are civil society organisations, stakeholders involved. So since 2000, there's been a firm commitment by the European Union and its member states to the deinstitutionalization of children in institutional care and support for their transition to care from a family and community, to care in a family and community-based setting. The European Child Guarantee is the first dedicated EU tool for policy and funding to tackle child poverty and social exclusion by identifying the most disadvantaged groups of children. And this includes children in alternative care. We have been looking at the available national action plans. Now, out of the 27 member states, 5 member states have not submitted their national action plan. The date was supposed to be March 2022. No member state submitted their national action plan on that date, so all member states were late. 5 are missing from the European Commission website, although you will find the Romanian National Action Plan on the government website, but not on the Commission website. The other 4 are Germany, Austria, Latvia, and Lithuania. In early 2023, as part of our data care project, this is EuroChild and UNICEF ICARO's project, we conducted an analysis of the 20 publicly available national action plans to examine their coverage of children in alternative care. Despite the lack of comparable indicators, the data care project demonstrated that all surveyed countries in Europe does collect data on children in alternative care. They do not always publish it and they do not always make it available. So I'd just like to give you an overview of a summative analysis that we carried out, and this is available on our website. So out of the 20 national action plans, 16 national action plans include specific measures to support children in alternative care. 12 include measures for care leavers. That means 4 national action plans do not include any focus on children in alternative care. 10 have monitoring frameworks, including indicators on children in alternative care. So just to give you some key findings. So we carried out this analysis in March. So as I said, 16 national action plans include specific measures for children. You will also find that out of those 16, Romania also includes such activities. For example, specific measures to support children in alternative care and for the advancement of reforms linked to deinstitutionalization. And you can see such measures as in Poland, planning to develop a central registry of children placed in foster care and educational institutions. Greece and Portugal, planning to expand and develop the capacity of underdeveloped professional foster care systems. Estonia, Malta, and Romania, focusing on preparation for and continued care for care leavers. Spain, developing national strategies to prioritize children in alternative care. Finland and France, focusing on tackling violence and abuse perpetrated against children in alternative care settings. These are parts of the plans. Many are not already implemented yet. So I'd like to just go over some of the recommendations that we've made within this report. And as I said, you can find the full report with all the information and the analysis on our website. So recommendations for the European Commission. We're recommending the Commission pays a particular attention to develop guidance on monitoring progress in EU child policy implementation, evaluating outcomes for children, and engaging with civil society and children in these processes. We're also recommending to the Commission that they use available data from national sources on children in alternative care to fill in the gaps. Much of this information is not available to everyone, but we know that they actually do have this data. We're also recommending to the Commission that they invest in the methodological work required to allow for comparable results across the EU. For national governments in the EU, we want them to seize the opportunity and the available policy instruments to support the mechanisms and the work with national statistical offices. We want them to assess the quality of their data systems and also look specifically focusing on children in alternative care, and to develop and implement data improvement plans which do engage with civil society and children in these processes. The European Child Guarantee is a unique opportunity for meeting the needs of the estimated 760,000 children in alternative care in EU countries. The aim is to achieve this by 2030. And we want to ensure that the Commission does also monitor the progress and the outcomes of such policies. And we want to close these gaps, the data gaps. The European Social Fund Plus, which I'll talk about in a minute, is one of the funding elements that supports the implementation of the Child Guarantee. This is funding that the national governments can actually apply for through the Commission. And the main aim really is to ensure that we improve the lives of children. You can see from the information in this report that 16 countries are already planning to try and improve the lives of children in alternative care. But the aim of this report is to encourage all other member states to do this as well. So today, I'm also representing the European Expert Group on the transition from institutional to community-based care, in short, EEG. So the European Expert Group on the transition from institutional care is a coalition who are advertising to replace institutional with family and community-based care. It has 12 members, including the European Disability Forum, Inclusion Europe, UNICEF, and EuroChild. So as a coalition, we represent children and their families, people with disabilities and their families, homeless people, people experiencing mental health problems, service providers, public authorities, and UN organisations. The EEG provides expertise on transition. We focus on how EU funding, EU law, and EU policy should be used to facilitate the transition. And we create a range of sources that are publicly available on the website and are actually quite useful. So I'm going to briefly go over the 4 resources. So this EEG guidance on the independent living and inclusion in the community has 6 guiding actions that member states and local authorities should take to ensure their policies and funding are supporting independent living and inclusion in the community. The following recommendations need to be seen as taking place simultaneously and not a step-by-step or a checklist. They offer a mixture of red flags, make sure you're aware and what to avoid. Also, positive practices that can be put into place, and long-term actions to implement to able to monitor progress in deinstitutionalization. So the 6 guiding actions are how to spot an institution and ensure funding does not go to continuing institutional care. We found that some national governments in the EU are actually applying for EU funding that is still going to institutions, which is illegal in the EU. 2, how to invest money in services that promote independent living and inclusion in the community. How to adapt services for the specific needs of children and minors, and how to offer support to families. Promoting independent living and inclusion through accessible environments. 5, how to avoid expenditures that indirectly reinforce segregation. And 6, how to better monitor improvements in the provision of personal assistance and inclusion in the community. Okay, the second one is a toolkit on the use of European Union funds for the transition from institutional to community-based care. It's often just called the EEG Toolkit. Now, the latest revision of this booklet was in 2014, but it is still very relevant. The EEG Toolkit is available in 13 languages, including Romanian. And also the annex of this toolkit gives a detailed overview of the relevant provisions from the European Investment and Structural Funds Regulation 2014 to 2020. Although this funding isn't available anymore to EU member states, the actions and the recommendations are actually still very useful and are still being used by member states. This report on the transition from institutional care to community-based care in the 27 EU member states really offers a broad picture of the situations, solutions and trends in deinstitutionalization and community living in the EU for persons with disabilities, with mental health problems, experiencing homelessness, children including children with disabilities, and unaccompanied or separated migrant children. Also, older adults are included in this report. It's based on recent findings, and you will find it highlights the key concerns and potential solutions that have arisen from some analysis of the information that we collated. This is the EU checklist. It's promoting, again, independent living and deinstitutionalization. This is the 4th resource. And it really is looking at EU funds 2021 to 2027 And this is the programming period where the current member states are actually applying for funding. And it is contributing to independent living and inclusion in the community. And it really is a checklist for what we call desk officers, the individuals working in the Commission that focus on very specific countries. And we're asking those desk officers to ensure that any activities meet the needs of the legal and policy framework EU fields. The focus is transition. It is also development of quality family-based and community-based services. There is a focus on prevention of separation of children, including children with disabilities from their families, and the prevention of segregation and institutionalization of children. And one of the things we also did within the EEG is provide training to the Commission on this checklist in 2021. One aspect I would like to draw your attention to in regards to deinstitutionalization is advocating for young children 0 to 3 to grow up in family-based care. This has been a key focus for EuroChild. It's particularly worrying that children under the age of 3 in the EU continue to be placed in institutions, despite evidence that institutionalization can have irreparable damage on infants' brain development. At present, the prevailing trend in the EU is to prioritise family-based care for children 0 to 3 or 0 to 6. However, this is changing in Czechia, who recently opposed not placing children in institutions. They are now adapting legislation that is going to make sure that, and aim to make sure that no children under 3 actually are put in an institution. The problem we've had is the recent circumstances in regards to COVID, the pandemic, or the influx of migrants and transfers of children from Ukraine. The institutions are now being used again, and children from 0 to 3 are being placed in institutional care. And we have found this in Poland, Romania, and Czechia. From our data care project, we found several countries had published data that does not separate children from young adults over 18. Again, going back to that, who are the children, how many children? Published data often does not allow for disaggregation of information on children 0 to 3. One of the key asks for many of member states is within their Child Guarantee National Action Plan is that they basically produce the disaggregated data. And that's one of the Commission's calls as well. So moving on to funding. The European Social Fund, ESF Plus, is the main EU financial instrument to support employment, education, skills and social inclusion initiatives. And this includes the measures within the Child Guarantee. Member states are encouraged to work with stakeholders, social partners and civil society. And the process for applying for such funding is the European Commission and Member States agree on the key priorities for the ESF Plus investment. These are the 2021 to 2027 partnership agreements. All Member States should spend 25% of their ESF Plus funding on social inclusion. All Member States should spend 3% of this funding on measures to tackle material deprivation, and all Member States should allocate an appropriate amount to the building of capacity of social partners and civil society. And this will be monitored through the semester report processing of the EU, where it will be checked if this is happening. So, the EU enlargement package. As you're probably aware, in June 2022, the European Council endorsed a recommendation to grant Moldova EU candidate status. The Commission will report on the fulfilment of the steps of the priorities specified in the Commission's opinion within the enlargement package in which Moldova was included this year. The EU enlargement package is basically the process or the consultation for each country that's in accession to basically meet the requirements of getting into the EU. In April, EuroChild provided a contribution to this enlargement package. We contributed this in a written form and through oral consultations on 7 countries, including Moldova. Our member Hope and Homes were the organisation that provided this information that we can then present to the Commission. And as I said, as civil society, this is one of the roles that we have where we inform the Commission of other information that maybe governments or other institutions are not providing. So I'd like to give you an example of how EuroChild and our members influence or inform the EU. So here is our report, Invisible Children, again available on our website, unfortunately just in English, apologies. So the Child Guarantee is part of a range of frameworks to support family strengthening and child protection. So as this is an example, we had two objectives. We wanted to provide the decision makers in the EU and at national level with timely and relevant information that we collected from our members at national level. We want to make children in Europe visible. We want to live up to the partnership principle to broaden policy and by drawing attention to the stakeholders' participation and the key information that stakeholders, like many of you in this room, can provide to your government. This report includes assessments provided by 35 national EuroChild members across 22 countries, 21 in the EU. And the purpose of the report was to assess the extent to which the European semester reports and recommendations are aligned to the lived experiences of children from civil society. So this is a bit like the UN Committee on the Rights of the Child alternative reports for the semester report in the EU. We also wanted to assess the scale of EuroChild members' engagement in developing the European Child Guarantee National Action Plans. We wanted to build knowledge of the experiences of children, families and communities living in poverty and social exclusion. And we wanted to provide a EuroChild member's perspective on investing in children through EU funding. Many member states state that they are actually involving stakeholders in funding and programming, but we know they're not. So our members give us, again, an alternative report on how EU funding is being used. So this report is shared with all decision makers. And for some of you that may have seen some of our work, our president, Her Excellency Marie-Louise Calera-Preca, who was the previous president of Malta, has been going around to President Metsola, different commissioners, basically handing over and talking about the report, specifically focusing on what needs to be done within those institutions. I'd like to finish by providing you with some key recommendations that are included in our report. These are relevant to most member states, and I would recommend these are considered by decision makers in Moldova. Invest in reforming the child protection system and DI. Family centres should be expanded and focused on enhancing parents' skills and on offering other support to keep families and children together. In this context, it is important to highlight in the EU that the number of children separated from families is not decreasing, it is increasing. You may want to check out a recent report from Ireland that more children are being put in institutions. Despite the changes in legislation and also emphasising preventative and community work, this should not be happening. We also want to draw attention to, within the Child Guarantee, free school meals. Often, member states only provide these then to primary schools, and they are not always healthy. We want to encourage all member states to provide free school meals to those children in need at primary and secondary level. Also be aware that children have told us the reason they don't accept the free school meals is because of the stigma. To queue up in a different queue because you're a child living in poverty is not fulfilling the rights of a child. We must ensure that children can access free school meals without thinking any stigma, any fault, any embarrassment. Meaningfully include children with migrant backgrounds, not only within their school environment, but in their community. Support their families. A child's life is not just lived in their school, but in their community and their home. Consider the lived experiences of all children. Ensure quality standards for child welfare professionals and mental health professionals. Consider how to create or develop these, ideally with the professionals and stakeholders themselves. You can find many more recommendations in the report. Collaboration is key. No one organisation or ministry can ensure all children's needs are met. By working together, we can make the changes needed to meet Moldova's goal of 0 children in the institutions and fulfilling the rights of children. Thank you.